All right, kickoff, guys. Thank you all so much, and welcome to episode 181 of the 988 Crisis Jam. Today, we are going to be learning about backpack healthcare, healing young minds, and our featured presentation speaker is Hafeezah Muhammad. I'm very excited for that conversation, and also, as I shared earlier, very excited because yesterday was the second anniversary of the 988 Suicide and Crisis Lifeline being available through a three-digit number. So very excited that you all are joining us today. Thank you so much for that. Let's get into this jam. All right, so starting it off, of course, of where you can find the information, including links to past jams, registering for the jams, virtual backgrounds, weekly reminders, upcoming information, and that's at talk.crisisnow.com. You'll see the highlights from last week already posted with Keon Lewis, who was the featured presentation, great presentation around Black suicide prevention efforts. And of course, this will be posted there as well. Broken out by individual segments, or if you have the whole hour, you can watch the video again right there on the site or on YouTube. And again, that website there is talk.crisisnow.com. And I mentioned our free featured presentations and featured speakers. We've had over 400 unique speakers since 2020, when this learning community was maybe a group of 10, 15 people. Since that time, we've had over 400, maybe even close to 500 unique speakers. You all may see your names here, but if you have an idea, again, for a presentation, if you have a different angle that we haven't seen, there's just so many facets of this. We want to make sure that we're hearing from you. So make sure that you reach out. The information is in the chat if you want to share information. No, Julio, we're not going to have terrible twos for the anniversary. So, and we'll hear from SAMHSA and others later. This has really been such an amazing change for crisis services in our nation, really. Three-digit dialing number for behavioral health, mental health, suicidal ideations, more people being aware of this resource. So this is a very exciting time. So again, let us know any of those three pillars, any item. If you want to be a speaker, reach out because we can get you on the calendar. All right, so of course, you all may have seen, and hopefully you have, that NPR did an article on the 988 Suicide and Crisis Lifeline turning 2 years old. And of course, it was in existence as the National Suicide Prevention Lifeline before this transition. And so a great article on that 2-year success, and of course, the work that we still have left to do. So this is, I highly encourage everyone to read that article. It is in the chat. It's really great reflection on where we have come from and the success that has happened with the work of the crisis contact centers, everyone involved, and still where we need to do some work. So with that, let's move to the next slide. And I'm going to bring up, Monica Johnson and Dan Gillison. And of course, Monica Johnson is the director of SAMHSA's 988 Behavioral Health Coordinating Office. And I think they're going to say some words around this 2-year anniversary.
Thank you, Laura. Hey, y'all. Happy anniversary. This has been a very busy week, as you all can imagine. And I would not want to be anywhere else here but Crisis Jam this week. I have the same message wherever I go. So if you've seen me in other places this week, one thing you will be able to say is, well, she is surely consistent. Thank you. It's a place I want to start from, a place of gratitude. I am 1,000% clear that we would not be here today celebrating this milestone if not for the collective work of all of us. I say that from being in a position when this all first started, of being on the planning side from a state perspective, the great state of Georgia, where we were moving at warp speed to try to prepare for the launch of 988. And then since then transitioning into this role, which I've now been in for a year and a half, I've had the opportunity to travel this country. I had a recent opportunity to travel outside the country to talk about the work that we are doing and how transformative it is. At 2 years old, I did see the terrible two comment. I can't lie, I thought the same thing, 2 terrible twos. But with 2 years old, we have accomplished so much. I often cite the evidence behind when I say that 988 has been a catalyst. Look at the legislation that's happened across this country. There's not usually this level of consistent momentum around trying to invest or look at ways to enhance not just the 988 crisis contact center work, but all the things that need to happen before and after. I am going to consistently talk about the importance of people that are experiencing a behavioral health crisis, knowing what to do, knowing where to go, and knowing that 988 is a place that they can start. So that is something that I hope for my grandchild, my future grandchildren, great-grandchildren will know that number the way that we all knew 911 as kids. And so that remains my hope. However, the work that is ahead of us and will continue is not just continuing to amplify the message around 988, what it is, the education around what it is not, but also what happens before the crisis and what happens after. So this is our opportunity. I don't think that this will happen again in probably not my lifetime and maybe not many of yours, where we are at the start of true transformation, because it is impossible to have a conversation about only 988 in a siloed view, only thinking about the crisis continuum, if you cannot have a real conversation about the prevention work that is required, that should still be funded, that is still needed, because just like healthcare, you don't want people to only show up to you in your system when they are experiencing a crisis. There is prevention work that we do in physical healthcare. We should continue to do that work for behavioral healthcare. We do not have a model where we say only show up because you're having an emergency, right? But if you do, we have something in place now where we can be supportive. You can get connected to a crisis counselor and then to also receive the appropriate response that you need. And we know that one of our major goals is that we are deterring unnecessary police response for a behavioral health crisis. So again, what happens then when the crisis is over? So states and policymakers, advocates, all of you are having to think about, well, what does that design look like when the crisis is over? It requires having a robust continuum of care that is there for when the crisis resolves. It requires investments in the social factors that we know play a role in individuals having the life that they choose and they desire, access to food, housing stability, employment stability, being able to have meaningful relationships. So these are all the things that I continue to think about as we take this moment. 988 continues to be our catalyst, but again, it is up to all of us to make sure that we're thinking about all the things. We're thinking about access. We're thinking about sustainable funding. We're thinking about equity. We're thinking about that no matter where you are, no matter what your background is, no matter what you look like, no matter what your culture is, no matter all the things, that you receive equitable access to those services. And so I applaud each and every person that is on this call that can hear my voice, because I know that you play a role somewhere in this big group project. You are playing a role in pushing these efforts forward. So for that, I continue to say thank you. The work has just begun. We have so much more to do, but I will not be shying away from the accomplishments that we have made as a country related to this work. We are 2 years strong, 10 million contacts answered is an amazing milestone to be at our very beginning 2-year-old steps. So just again, thank you. Thank you all for having me today.
Thank you, Monica. I don't know if Dan is, oh, Dan, you are here. I was going to invite you. And I also see Tia's here. I'm not sure if we can get her on here, but Dan, wanted to give you some space for your reflections on this 2-year anniversary.
Laura, thank you very much. And Monica, thank you for your comments. You were really talking about the social determinants of health and really appreciate what you were talking about in terms of that continuum. It is time to celebrate. It is time to recognize all of the incredible work that's going on. And as you all can see on the screen, I have Hope behind me and I have Hannah as my name. So just know that it is Dan Gillison and Hannah is our Chief Advocacy Officer. And we had to navigate to get in today. So my apologies, but hope is so critically important to this conversation. And let me start out by saying we have about 198, almost 200 people here. You know, people don't care how much you know until they know how much you care. And you guys have demonstrated 2 complete years of caring, of giving a darn, of being here every month and every day to really increase the awareness of 988. And again, people don't care how much you know until they know how much you care. And I want to just praise, acknowledge, and recognize every one of you because you're giving your time and your talent to this work. And it is an incredible body of work. And also want to praise SAMHSA for the dramatic increase in crisis services and capacity. If you think about 911, 911's only been around about 53 years, you know, and 911, they were not able to do what we've been able to do in this short period of time. So kudos to you for that. And it is absolutely time to celebrate and also to look at what this work looks like going forward. To that point, I do want to reflect, and I made some notes, and I'll do that very quickly. But when I think about 2 years of 988, I think about the societal shift that we're seeing. Mental illness, substance use, and suicide are things that impact so many of us and our families, mine directly. So for so long, we've been ostracized or criminalized, and anyone that's been experiencing this has been criminalized or ostracized. Any person in a mental health crisis deserves to feel seen, safe, and supported. But it hasn't always been clear who to reach out to for help or what that help would look like. But now all across the country, there's 988. It's free, it's easy to reach, and we're seeing that it's effective. To that point, on last Friday, I was at a congressional event in a community with some colleagues, and there was a woman that came up to ask a question, and it was talking about her adult 22-year-old son, who she said was very loving, caring, and something had changed, and she was now concerned about his well-being and her well-being. And as she spoke and we offered support, Congressman Frederica Wilson said, I want all of you on this audience to know about 988. Think about what I just said. We had a congresswoman say to an audience of a standing room only audience about 988. It didn't have to come from us. She said it from her posture. So you guys have been doing some incredible work. I also want to say that the incredible impact of advocacy, especially from people with lived experience. There's a version of history where the switch to 988 would have been nothing more than a number change. It is so much more than a number change. The services available today are so different than 2 years ago, even 1 year ago. And they get better every day because we believe in Kaizen, continuous improvement. We all deserve a mental health response in a mental health crisis, which is why NAMI decided to call our 988 advocacy campaign Reimagine, because we all have opportunity to reimagine a crisis service care system in which every person, every family member gets the help they're looking for. And that's exactly what the people on this call are doing. When I come to this work, I don't come to this work with that label CEO. I come to this work as a father, as an uncle, and as a son. And I want what we are all working towards. So thank you for that. While there's more work to be done, we're getting closer and closer to that vision. For that and for all the people NAMI represents, I say thank you to each and every one of you. I thank the advocates, the partners, the federal and state and local policymakers who have worked tirelessly, and I'm sure through many sleepless nights to get us to where we are today. And I want to thank our partners at SAMHSA, Vibrant, and all of the call center and crisis care providers on the call who are saving lives. 10 million people have gotten help. I want to pause for a second. 10 million people have gotten help. That's incredible. Imagine what else we can do when we keep working together. And I'll close by one, I want to thank our interpreter, our ASL interpreter. Thank you for your work. And there's an African proverb that many of you know. You want to go fast, go alone. If you want to go far, go together. So thank you for doing all of this incredible work together. Excited. And as we celebrate it, we know that there's more to do. And just let's ride the crest of this celebration to see what we can evolve 988 to be going forward. Thank you, Laura. And thank you all for what you're doing.
Thank you, Dan. Well said, and just thank you for your partnership. Deanna and the entire team at NAMI have just been so wonderful in the advocacy space and, all working together to make sure that we're providing the services that folks need. I want to, if we have just a little bit of space here, also bring up, I see Dr. Tia Dole, Chief 988 officer within Vibrant. So I want to have her come up and make a few remarks and reflections.
I was not prepared to speak, but I am prepared to say something. Thank you. Thank you, Laura. I'm going to stay on for 1 second and just, one of the things I was thinking about while Monica and Dan were speaking, we're the administrator of 988, and we've actually worked with the Lifeline for nearly 20 years. But one group I want to highlight in today's conversation are states, territories, and tribal leaders. What Monica was saying was 100% true, which is that this is a transformational moment. And what I also see at the state level is incredible, which is an unprecedented investment beyond 988, right? So we're talking about 988, but this is about the crisis continuum. 988 is the connector. It is the connector to mental health services. It's a connector to mobile crisis teams. It's a connector for outpatient treatment. It's a connector for other resources in folks' neighborhood. But what I'm seeing that just fills me with hope, and I wouldn't be a clinical psychologist if I didn't have hope for change, is that states, tribal leaders, tribal affiliations are investing in themselves. And that's a beautiful thing to see. So that's all I'll just say. And also just excited. I'm not a fan of terrible twos. So my hope is that we'll have the one kid who's nice. So thank you so much.
All right. Thank you, Tia. This has just been a wonderful reflection, and I'm glad we're taking this space. It's a little longer than usual in this section, but just really great to see and hear all of those great remarks and think about the work that we've all done to get us to this point and where we have to go. So with that, let's do, let me just say a little bit more about the news. We have nominations open for the first ever SAMHSA Trailblazers and Advancing Recovery Star Award. So make sure if you all know any trailblazers in the recovery space that you are nominating for them, that link is in the chat. And of course, we have our 988 sighting. So if you do see 988, please make sure you send that in. We can get that featured here on the Jam. And this feature is Mississippi's Choctaw. And please forgive me if I mispronounced that, Indian Fair. And again, just highlighting, as Tia mentioned, the work that tribal nations, communities, First Nations are doing in highlighting 988 Suicide and Crisis Lifeline. And I also want to shout out here the Washington State legislators who created a Native and Strong option for individuals in their state. So again, making sure that we are serving individuals in a culturally competent way, in a way that they want to. And again, as Tia mentioned, investing in themselves. Great sighting, and make sure that you send yours in as well. So that puts us to the hot seat. I'm going to do a quick call You can raise your hand or call out if you want to be in the hot seat. I'll just leave that open for 30 seconds. You see the opening primer here. If not, this will be a collective hot seat for everyone. So do we have a brave soul who would like to take this one on? Okay, last call. Okay, all right, well then this one will be for the entire audience. That's right. You can get a 988 shirt, hat, if you do volunteer, but since this one's for everyone, unfortunately we can't send it out to you for participating in this one. But as we think about yesterday being the anniversary, the second anniversary, prior to its inception, the National Suicide Prevention Lifeline had launched the number 1-800-273-TALK, providing free emotional support to people in suicidal crisis and emotional distress. So our question today for the entire audience, make sure you weigh in, is what event occurred in 2020 that was a key step to the implementation of 988? Was it A, the National Suicide Hotline Improvement Act was passed? B, the FCC submitted their report to Congress recommending 988 be the designated number. C, the National Suicide Hotline Designation Act became law. Or D, the 988 Lifeline was launched. This one I thought was pretty easy today. It's a little tricky, but Jana, we would have loved to have you on. You could have had a shirt or a hat maybe next time. But make sure, and again, folks, you can put your thoughts, comments in the chat, but make sure you do fill out the poll here. And we will see those results. Okay, so we have 22% saying A, 40% saying B, 30% saying C, 8% saying D. Dana, you know the answer. You say that you know the answer. Which one would you choose?
I am like 90% certain that it is C.
Okay, let's see that. This is if you could have had a shirt, hat. The correct answer is C. You are right. And just a little history, since I am a policy nerd or wonk, the National Suicide Hotline Improvement Act, which required the FCC and others to study what the number should be, that was passed in 2018. The FCC submitted their report to Congress recommending 988 in 2019. The Designation Act, which was the law that required FCC to pass a rule formally designating 988 as the number, became law in Suicide Prevention Month in September. Well, it was passed Congress September 2020, became law, was signed by the then president in October 2020. And then, of course, the 988 Lifeline launched in 2022 using that new 3-digit number. So, Dana, you would have been right. And I just want to shout out everyone in the advocacy community. You all see how quickly that happened, 2018, 2019, 2020. That does not happen typically in the advocacy world. It takes a lot of time, and even going back to the folks in Utah who really got this started. So kudos to everyone who's uplifted this. I also want to shout out folks who maybe aren't here, but Hunter Job was very helpful in pushing this. Michael Pasquarelli, everyone at NAMI, MHA, AFSP. This was a small ragtag group of us back then, and of course it has just blossomed into this amazing transformation of the crisis continuum. So maybe next time we can get someone in the hot seat and get a t-shirt or hat. So with that, I'm going to try to get us back on time, but I am going to turn it over to our featured presenter, Hafeezah Muhammad for Backpack Healthcare. Hafeezah.
Hi, thank you so much for having me. I have a 2-year-old she's going to be 2 August 1st. So we definitely hope that there's no terrible twos with 988. So I'm happy to present Backpack. We're a pediatric mental health company. And my personal story was that in October of 2020, my son, who was 6, came to me and told me that he wanted to kill himself. My heart broke. I didn't see it coming. because of my son's disability, he was on Medicaid. I struggled to find care. At the time, I was an executive at a national mental health company. And as I said, I never want another parent to go through what I did. So I left my job and I started Backpack Healthcare. And as we go to the next slide, I realized that my son was not alone. There are more than 40 million children in the US or on Medicaid that need access to mental health care. And it's hard to find providers. Either there's a lack of qualified providers or, there's challenge in reimbursements. And this is where we come in. We provide therapy, psychiatry, we'll highlight that on the next slide. Therapy, psychiatry. We have our self-care app to help support, and we provide workshops. We wanted to ensure that there was a way for us to be able to provide this care to this population, a company that was built on that ability to be able to do that. And also, as a mom, I felt really embarrassed. I wanted to see, was there a self-care solution I can use? Because we all can admit, if we're parents or we serve kids, you don't want everyone to know because you feel that it's your fault that this is happening. And I couldn't find something that I found that was reliable, that I could trust, that was fun and engaging. And then I also searched for things like workshops. Is there something I can learn to better help my son? And when we couldn't find all of that, this is why we provided all of these solutions. And as I looked at understanding why is there such a shortage, it was just my dream of finding out the reason, the root cause. I found out from a social work perspective, there's 40,000 graduates every year. And then it's hard for them to, to finalize their license because they have to pay for their residency hours or their hours after they graduate their master's program. And as a result, 56% of them were dropping out of the field. So I said, it's not that there's not an issue with individuals who want to provide this care. There's something that's a challenge for them to be able to provide that care. So as I worked with my clinical team, we started looking at ideas of what we can do to help bring more providers into the market that can help support these particular patients like my son, and also find a way for them to ensure that they can get their hours needed to become fully licensed. So what we did, which highlights on the next slide, is that we created our residency program where it's a 24-month fully virtual graduate level program to help provide support for these individuals so that they can support the patients in need. And also finding out that, at least from a social work perspective, we do provide support to counselors and social workers, that 90% of white clinicians pass the test on the first try versus only 50% of BIPOC clinicians. So ensuring that we're including ways to ensure individuals pass this test. We have about 8 university partnerships. And to give you an idea about how exciting this program has been, and we hope to expand it, last year we had 500 applicants that applied to the program, but we were only able to provide support to 25 people. So if there's anyone that needs to be able to find support within their organizations, please let us know, because there's a lot of people out there who is looking for that type of support. And also I started thinking, once they come to Backpack, how do we ensure that we keep them motivated? A lot of my providers were saying that they're feeling burnt out. And I started trying to understand, what is their day like? The administrative burden that I saw was just absolutely atrocious. The treatment plans that they're creating, the progress notes, is just nonstop administrative stuff. So I worked with my team, and we actually partnered with NIST to shape policy for mental health, for pediatric healthcare, and also mental health, so that we're able to bring AI solutions to make their jobs more easier. One of my executives was at Meta, and he wanted to make a difference. So he left Meta to lead our technology evolutions to help support that. So we'll showcase a couple of our solutions today so you can see how we help support providers to be able to make that difference. And highlighting some of the solutions that we have is that patient treatment plan generator. It was taken, you'll hear from Ryan and Olivia, 45 plus minutes to be able to create a treatment plan. Right now, we've automated that to help reduce the time. We can match therapists with the right patients, progress notes automation, and chatbots to help ensure that we can provide care in between sessions, not care delivery, but answer questions, and a care companion to support those who's looking for support. More than 60% of our patients are BIPOC. So what this allowed us to do is to ensure that anything that was trained represented the true makeup of the US, which was really exciting for us, which now more than 50% of the kids in the US are BIPOC. So I kind of want to tell you about a patient, Olivia, about the journey with Backpack. And to give you a high level journey of Olivia, she was in foster care, removed from her home. She was hospitalized because, you know, there's a long wait list. She was discharged. And at that time, you know, she came to Backpack to get care. If this worked in the right way, this is what would have happened, is that she is removed from her home. She gets care coordination from our team, reaches out to her to begin treatment. Culturally intentional care, our average time to see a patient is 5 days. She gets within our app. She starts doing bibliotary modules. She gets work, support, therapy in between that time. We keep her parents or her guardians engaged throughout the process. We ping her to schedule a time with her primary care provider. In that same 42 time frame that it took Olivia to go into the hospital to get discharged, she was able to have a significant drop in acuity and continue to provide support within our platform. So it gives you an example of what this looks like from a patient population and how we can receive care quickly, efficiently. And what it looks like is just giving you more information in the next slide about, you know, where we're located, from who we work with. So we work with Medicaid as our top payer, commercial insurances, pediatrician offices, Department of Social Services. The referrals come into our system. We refer back out. They use our platform. This is what it looks like. We also are, right now we're in 4 states, Georgia, Virginia, Michigan, and Maryland, where we're at, but we're also expanding. And this wouldn't we have to also talk about, does this work? We talk about a lot of great innovations, great things that we do. So the next slide, we talk about how does our symptoms improve and what are the outcomes? So with our therapy, psychiatry, our patients have seen a 76% reduction in their GAD-7 scores, 80% reduction in their PHQ-9. But we've done more than 26,000 sessions. But what's unique is that we have a language line integration where we provide support in over 250 languages or dialects to ensure that we keep up with the model of cultural intentional care. And we cover that cost with our translation services. So people are wondering, what does the platform look like? You know, we talked about, you know, reducing GAD-7, PHQ-9, fun, innovation. So this is something that we'll showcase to let you know, show you a video of how it all works together in one spot from the patient perspective. So I'll key the demo and then we'll have you guys, you know, play with one of our care companion that's coming out soon, and we'll kick off the demo. All right. So this is a demo of our all-in-one platform, what that looks like. And I'm going to share my screen because I know we have quite a bit of clinicians on the call, and I want to show our patient treatment plan generator to give you an idea of what it looks like on the back end. So you guys are seeing a very raw portion of it, and I will share that now. All right, so this is the back end of our patient treatment plan generator. We ensure that, we usually get this information all up front. So we look at anything from social determinants of health based on the information that they're putting in. Depending on what various symptoms or diagnoses they have, we can select various diagnoses. We can add areas of difficulty, whether it might be school or whichever area that they might be struggling with. It could be various areas. And it takes about, 10 seconds to generate this treatment plan. And you'll hear a little bit from Ryan and Olivia, who actually uses this from a front end perspective so that we can see, what it does. So it also ensures that it takes the clinicians from being a writer to an editor. They can make changes to it, but you see how quickly it takes them to be able to generate a treatment plan to ensure that they have the SMART goals to help ensure that it can be customized, their frequency and different various things, and to help support the patient throughout their journey. The good thing about this is that the clinicians has the final say on whether or not what gets submitted based on their assessment. So they can edit, they can make changes. So this is just giving you an idea of one of the ways that we help reduce burden for our clinicians. All right, so the last highlight is going to be interactive. And this is something that we've been working on for quite some time. We've never shared it with the public before. And this is a back end of Zip and what it looks like. What we want is your help. So if you guys can go and log in to the Care Companion, we'll drop the link in the website, in the chat, as also you can scan the QR code. The ID is backpack and the password is crisis 988. So we're trying to tie it into this day. If you guys can ask any questions, because one, it will allow us to see what questions that are being asked. And then second, it will allow us to see some of the responses, and some of you might be able to share your responses. What it does is allow us to see what we can improve on, and also see that get your feedback on it, how it can be improved. This is something that we are going to be launching to help support families or children who might need support, and that's going to be coming out next month. But I wanted to get your feedback. So if anyone logged in wanted ask any questions related to mental health, it could be around you might be hungry, whatever you want to ask that you would typically see in a session or from a family that you work with. So I'll let you guys spend about 30 seconds asking questions, and hopefully someone can share their feedback, what their thoughts were within the chat and how it works. So this is our Care Companion.
Awesome. Thank you, Hafeezah. I know folks are going to, click the link and use that ID and password. So I think we can get in there. Would this be a good now, Hafeezah, bring in the roundtable?
Yeah, absolutely. So this is the perfect time to bring in a roundtable. So we'll turn it over to Ryan and to Olivia.
Hello, everyone. Happy to be here. My name is Ryan Glasspan, licensed therapist.
Hi, I'm Olivia Price. I'm our residency program manager at Backpack Healthcare, and I'm also an LCPC in Maryland. I appreciate you all giving us some space to chat about Backpack today. As you're playing around with the Care Companion, right? This is just one of the many tech endeavors that Backpack is really fully immersed in. You saw our treatment plan generator, which has been an absolute really lifesaver on the clinical side. It has significantly reduced the administrative burnout that I know that I and my fellow clinicians are feeling, and has given us more time to intentionally prepare for our sessions with clients by not having to generate the goals, but more become, like Hafeezah said, the editor and fine tune the goals with the client to their specific needs. We're now able to use that extra time and emotional and mental energy to not only prepare for each session, but also to better ourselves through trainings that Backpack does offer. Backpack Healthcare is currently accredited with the NBCC to be a continuing education provider, and we're also pending approval from the APA and ACA as well. And there are countless opportunities that are provided to our clinical team to further their training, just so that we can feed it right back into our clients.
All right, Ryan, you're a new clinician going through the residency program as well. So
Yeah.
give
Let me
us
tell you a
2
little
minutes.
bit. Yeah,
Yeah.
of course. So, just some information about myself. I am pretty new to the journey as a therapist. Got my license late last year in November. As I'm job searching, I stumble on Backpack Healthcare, and it's one of a kind because it offers this residency program that will enhance my career and one day be a supervisor. And currently in the residency program, I get great support and supervision. I always feel like I have someone to lean in on when I feel like I need questions answered on day to day. And then another thing that makes Backpack one of a kind is the AI solutions. It's really a game changer, not just for the clinicians, but also for our patients. We talked about the treatment plan generator. It is a lifesaver. It reallocates our time, making our time with our clients more natural. We don't have to worry about getting our notes done. It takes the stress away.
All right. Well, thank you so much for sharing, what it's like from a roundtable perspective. Sometimes it's always good to hear it from those who provide care, which is, I always joke around and say, the most important and most impactful individuals at Backpack, because we build it for them to make their lives easier so that we can reach more families. And I'll turn it over to if there's any questions from anyone, or
We do
we
have
can
a
get some
question
time
in the
back, Laura. Yes.
Well, we do have a question. I want to make sure we get to it. Is the care companion for the therapist or directly for families and individuals?
Could be for both. So it will be for both. Therapists can use it. It could be families can use it, and it can be individuals that can use it.
Awesome. Okay. Well, if there are any additional questions, make sure that you put them in the chat. You can also use that link to an ID and password to provide feedback and questions there. But just so grateful for you all sharing this. This is very exciting and very innovative. Can you let us know one more time where the 4 states where this is being used?
Maryland, Virginia, Georgia, and Michigan, and we'll be entering additional states. And if anyone wants to partner with us to enter other states, let us know. We're happy to help support. As Susan said, go fast alone, but if you want to go far, we can go together. So we want to go together with as many people as possible.
Yes. Thank you so much, Hafeezah. That is, I think, the theme today. It's really taking all of us. I'm going to wrap this up. Susan, I do see that your additional question came in. Maybe, Hafeezah, you can get to that one in the chat.
Yes, absolutely.
Awesome. Thank you. Well, then, at this point, I'm going to turn it over to Wendy Morris of NASHA, the National Association of State Mental Health Program Directors.
All right. Well, thank you so much. Gosh, what a privilege to be part of this particular episode celebrating the second anniversary and such great presentations. Love the backpack program. So I'm just going to talk for a few minutes. During my tenure as commissioner here in the state of Kentucky with the Behavioral Health Department, I always called summer the conference season, and that has really held true since I joined NASHBID. In addition to our upcoming annual meeting, collectively, the staff here at NASHBID has been participating just in a whole host of conferences and workshops, convenings, and important conversations over the past several weeks and months. And I'm just going to touch on a couple events I had the privilege of attending last week and kind of tie them to some of the conversation today. So first, I was able to join CCBHC Technical Experts Panel at SAMHSA. Clearly this is an option for a place to go post-crisis. It's an important part of the continuum. And there were three major themes that I kind of pulled from that conversation. One is the whole importance of community and that concept, that it's so important for CCBHCs to collaborate with local partners and stakeholders, including 988 call centers, that their services really need to be individualized to meet community needs. So it'll look different everywhere. There was a gentleman there from very rural Colorado who talked about an informal drop-in center, not a traditional service where they served what he called cowboy coffee, which I guess is straight black coffee. We talked about workforce development and how that's going to vary from community to community, the quantity, the clinical competency that's needed, the distribution, the concordance, so that we make sure that our workforce mirrors the community that it's serving. The second big theme was reimbursement, the sustainability of the PPS model, parity with private insurance. Talked about contracting with federal partners like the Veterans Administration and working with tribal communities. And then the third theme was data. How do we quantify the savings to the behavioral health system, to the criminal justice system, and so on? How do we show concretely the impact that we're having? And are we aggregating the data that's important to our funders, to Congress? The second meeting that I attended later in the week was at the National Academies of Science, Engineering, and Mathematics. They hosted a work group on behavioral health workforce development, and they opened with a keynote panel instead of a keynote speaker, which was really lovely. And everyone on that panel gave some really thoughtful comments. One of the keynotes talked about how we need to be shifting our care paradigm from a waiting model, I'm here in the office, please come see me, to a seeking model. I'm going to meet you where you are. I'm going to come to your point of need. And that's really what 988 and mobile crisis is all about, Getting out there, meeting people where they are, and providing those services there. Another keynote panelist talked about developing communities of care instead of just focusing on workforce development. Another noted that we should be considering what is the collective skill set we need rather than focusing on specific disciplines that we need an A, a B, and a C, but more what is the collective skill set we need. And that they also pointed out how, again, different communities may need a different set of skills for their respective behavioral health teams, and it's very different community to community. So very common themes through both of those convenings. We know workforce development, and it came up today, Workforce development continues to be a pervasive issue. And there's a palpable interest in shifting our care paradigm and reaching underserved communities. And it's just so exciting, There are several federal and national organizations that are working together with the goal of collective impact, coming together, creating synergy, learning from another, building on what we're doing so that we can find solutions to these big problems. And having worked in the behavioral field myself for more than 30 years, I just find this time so energizing, and I feel so hopeful about what we're going to be able to accomplish together. I do want to take this opportunity to just make sure the audience knows about a couple of new resources from the National Council on Mental Wellbeing. It includes a crosswalk of national workforce development solutions, and they've started a monthly workforce jam, kind of modeled after this crisis jam. It's held once a month on the third Tuesday at 1. So it was held yesterday. The next one is August 20th, and you can find more information about the crosswalk and the workforce jam on their website. So thank you. Good to be here today.
All right, thank you, Wendy. Lots of good information. I appreciate the conference even, because it really is. But then, as you mentioned, everything does pull back together to exactly what we've been talking about and all the work that's been occurring. So with that, I am going to bring up Hannah Wazalowski, who we saw earlier under when Dan came in under her name. She is the Chief Advocacy Officer at NAMI, and she's going to talk to us about some great new data that they have led. Hannah?
Yeah, thanks, Laura. It's so great to be with everyone here. I feel like this is home, this community, and always happy to be on. Just wanted to share that NAMI released our new 988 Lifeline and Crisis Response research on Monday, July 15th. We started doing this research with Ipsos back in 2021 because we wanted to know what people knew about 988 and crisis response, what they expected to get, and what they demanded for care in their communities. So this is our fourth poll that's focused exclusively on 988 crisis response, and it's our sixth poll that's looked at 988 awareness in some way. So this was conducted in early June and used Ipsos knowledge panel and includes over 2,000 nationally representative adults over the age of 18. So I want to share a few key results that we found and link to more information. So next slide, please. So this is the big one. As you can see, awareness and familiarity with 988 have jumped quite a bit since a year ago, and certainly a huge amount from 2 years ago. They're a little bit consistent with our October polling. I'll note there's a slight dip on that awareness line, but it's not statistically significant. So what's awareness versus what's familiarity? That's the question we usually get. Awareness is that people have seen or maybe heard of 988, but they don't really know what it is, who it's for, and what it offers. Familiarity is the group of people that have a good idea that it's for mental health or suicide, know how they can contact it. So what we found, digging into this a little bit more with demographics, are white and Hispanic adults are more likely to be familiar with 988, and 18 to 29-year-olds are the age group that's most familiar with 988. So that's consistent from what we found in the past. That number continues to grow. Next slide, please. So we asked, have you, of the folks that we were talking to, have you contacted 988? And if so, what was your experience? So about 3% of our respondents had contacted 988 or had a loved one who contacted 988. And that's pretty consistent with that $10 million person contacts that SAMHSA just announced for the 988 Lifeline. This, I think, is real positive takeaway from what people are experiencing. The group who didn't receive the help they needed decreased a pretty significant amount, but the number of people who got the help they need jumped a lot over just a year ago. So this is definitely trending in the right direction and is a really positive takeaway that people are getting the help they need when they reach out to 988. We could go to the next slide, please. So finally, just wanted to share a little bit more digging into who do people trust and where do they want to go? Most Americans said that they would be likely to reach out to 988 in a crisis. That's much higher than those who said that they'd be likely to reach out to 911 or to a law enforcement officer. And it's very close to the number that we see for somebody who'd be reaching out to a mental health provider or a close friend or family. So that's very high and very good news. Interestingly, we found out that 18 to 29-year-olds are generally less likely than older Americans to reach out for professional support during a mental health crisis or emergency. So that's concerning given our youth mental health crisis and something that I think all of our groups need to think about and how we build that number for any sort of resource that 18 to 29-year-olds can utilize in a crisis. Relatedly, most Americans are comfortable contacting 988 in a crisis. Black and AAPI Americans are significantly less comfortable going to law enforcement than white and Hispanic Americans. And new question we asked is, what would make you most likely to reach out to 988? And about half of people said the biggest factor to reach out to 988 was that they speak to somebody immediately. So that really speaks to the need to continue the funding and the work that so many on this call are doing to make sure that we maintain the capacity and we keep those answer rates and average speed to answer high. 49% said that 988 should be a high or the highest funding priority for Congress. So we will be using that in our advocacy. We encourage others to include that in their advocacy, but we need those resources to continue to meet the growing demand. People still worry if their crisis is crisis enough. 51% don't know when a situation is serious enough to contact 988. So again, just more fuel to the fire to continue pushing people. When in doubt, reach out to 988, that no wrong door approach to getting people connected to care. There's a lot more in there. Steph dropped the links, but if we can answer any questions, feel free to reach out to me directly. I'll put my email address in the chat, but really grateful to have a few minutes to share this today.
Awesome. Thank you, Hannah and team. This is really great information. I'm glad to see that folks are being helped by the Lifeline. So with that, I'm going to bring in Stephanie Hepburn for our crisis talk segment. And again, as a policy wonk, this one's pretty important to me. And let's talk about the legislative side of things. So Stephanie, take us away.
Thanks, Laura. So I'd like to welcome William Hudak. He's a former senior public health advisor at SAMHSA Center for Mental Health Services. Bill, how is having a loved one affected by behavioral health been important to the politics of bipartisan healthcare legislation and parity?
Well, first of all, thank you. And it's great to see so many people that I know here and continue the work that we're doing. I think to answer your question, first of all, we have to look at advocacy and recognize the fact that most people get into advocacy because of a family situation. And that is true of clinicians, that is also true of individuals, family members, etc. And advocacy, obviously, you have to engage first, then educate, and then you actually can advocate for change, to build coalitions, and then follow up. But that then ripples to the next level. And the next level are organizations like Nashville, which has just done such a wonderful job of advocacy on behalf of parity and also on behalf of so many other issues, representing the states and territories, but also representing the field. That then ripples up to the next level, which is that we have to recognize that in Congress in particular, nobody used to talk about mental health. Mm-hmm. It was hidden. And only when we started to speak about it could we start to build things like the Mental Health Coalition, our caucus that's in the House. And only then could we start to have champions like Paul Wellstone, Pete Domenici, and people who would follow upon their leadership. Ted Kennedy and Orrin Hatch, both of whom had personal history, were very, very deeply engaged and involved, and frankly, to a large extent, responsible for being able to get the Mental Health Parity and Addiction Equity Act of 2017 passed.
So we spoke about John F. Kennedy, and that was how our interview started. If you want to share a little bit about Rosemary Kennedy and how that impacted his momentum in making shifts for parity.
And again, if we look at this, in the 1950s, most people didn't speak about mental health at all. Mm-hmm. Frankly, in the 1950s, nobody spoke about cancer at all. So, we see the trajectories being very, very similar. But what happened was John F. Kennedy, in particular, saw what happened to his sister. And his sister went through a lobotomy, which was, at the time that it was done, a fairly common treatment. And he recognized what that did to her. And he recognized the fact that the promise and the humanity of that individual was compromised. as a result of it, and he never forgot it. So he brought forward that life experience into his own beliefs that we had to do something better. And in that regard, he pushed for parity in its very, very earliest forms, but he also pushed for deinstitutionalization. He pushed for ways of being able to create answers within the community so that people could remain socially integrated.
Thank you so much for hopping on with me. I'm going to pass it back to Laura. Please take a look at the article. It was great to interview you, Bill. Thank you.
Thank you.
Laura. You're on mute, Laura.
This is what I felt. Next week, we've got episode 182, Craig Leeds, Andy Nielsen on safe social spaces. So important, particularly as we think about young people being online. Please make sure you join us. Thank you for joining us today. The week after that, in 2 weeks, we have the first episode programming with Dr. Laura Sykes. We have lots of great information coming up. Thank you all for joining us. And again, thank you for all your work that you've done to get us to this point. Have a great rest of your day, everyone.